Hey everybody, it's Ohad Pearl here, Geriatric Care Manager for Covered Caregiver. Good to see you again. The reason for the video today, we've got some really good news out of Kaiser Health News, a nonprofit organization of the Kaiser Foundation that put out this great article titled How Older Adults Can Regain Their Game After Being Cooped Up for Over a Year. Just a wonderful title, really makes a lot of sense here in the caregiving industry. This is what we've been dealing with many elderly and seniors who've stayed at home for over a year now and have really been cooped up, haven't been active, haven't seen their doctor. And this is a great article in getting into some of the items and challenges and how we can address them. And of course, I want to share my thoughts on what we've seen in the past year with our own clients, our own community, and then conclude with a little bit of advice. So let's get started. This is an article written by Judith Graham out of Kaiser Health News. And, one of the very first things that they want you to do, great advice from experts, is reconnect with your physician. You might not have seen them for over a year. And in the beginning, we can recall that having doctor's appointments canceled because waiting rooms were an incubation center for the coronavirus. So while you were sitting there and you might have been catching something, COVID in worst case scenarios. And so all doctor's appointments that were not essential were canceled. And doctor's offices for the longest time were put on hold. And so many of our seniors were not seeing their doctors. And so a very important thing is, go see your doctor, schedule that appointment. And then not necessarily just your doctor. You can do your dentist, any of your other specialists, any other type of health professionals that you haven't seen in a while. It's a great way to reconnect with them. Now, when you're seeing your primary care physician, which is important, you want your general functioning assessed. And so primary care visits should include a basic assessment of how older patients are functioning physically. And one of the first things that we need to recognize is because you have been inactive, another one of these challenges to address is to get a referral for physical therapy. Not every primary care physician will have it in their forefront to refer you to physical therapy. In other words, physical therapy falls under the home health care umbrella. Not necessarily home care, it's home health. Home health is the medical version of the caregiving, and it encompasses the medical personnel such as nurses, physical therapists, occupational therapies, even social work and psychologists. So, but most importantly, I think what we should be looking at is that when you request a referral from your physician, you would like to focus on physical therapy because of the inactivity over the last year. And of course, if you're having trouble moving around, this is a great way to get started. Physical therapists are wonderful health professionals who know how to identify situations and problems within your movement, your abilities, and get you going, and then pursuing growth in that forward moving, whether it's exercises and stretching or pushing you to the next level. And of course, home health can only last so long that your insurance will cover. So it's important that they leave exercises and how to maintain that level of growth that you've seen with physical therapy. And of course, a physical therapist would always start slow and build steady from there. And the same thing goes to you. If you feel like you can start walking around the block, go for it. And if you can push further than that, walk to the park, walk your pet, walk to the local grocery store. And that keeps you active. And if you get a friend along who has also been vaccinated, it's perfectly fine. Walk with them to the store and walk back home. And so important to start slow but build steadily. And of course, another suggestion here to face some of these challenges is to reestablish routines. Well, what were you doing in the mornings prior to COVID? Were you going out for that walk? Were you having your coffee and pastry and then reading the paper and going out for the walk? Were you visiting friends? Were you running some errands or laundry? Were you visiting family? Was family coming out and visiting you? Were there new hobbies and other traditions that you had going on a daily basis, on a weekly basis that you can now essentially restart? So all these things you want to think of so that you have a routine going for you and an active routine. And of course, downtime during the day after you've been pretty active is also part of that routine. Have a nice lunch, a healthy, light lunch. Follow all your doctor's orders if you have low sodium diets or you're on a diabetes diet. Then make sure no sugars and low sodium for those, and then take a good nap for lunch, and then restart in the afternoon with a good episode of Judge Judy and another walk around the block. Go visit a friend or have family come over. If you have grandchildren that you're seeing, take them to the park and be active with them as well. So establishing those routines are extremely important. And of course, what we also want you to do is, as we mentioned in that routine, is eat well. It's important after being so inactive for so long that we might have actually gained a little bit of weight. So it's important to add that into your routine, into your daily schedule, to eat healthy, eat fruits and vegetables. And of course, if you have a specific diet you need to stick to, speak with your dietitian and nutritionist. If you haven't been in touch with them over some time, just like your primary care physician, you want to touch base with that dietitian and nutritionist. And you've never been to one before and you felt like you've been inactive or you've gained some weight, you feel a little more lethargic, it's also great to ask your primary care physician for referral to a dietitian or a specialist in nutrition. And so with that said, this was just a wonderful article that made some mainstream news. We actually saw this on CNN this morning and felt like this would be an important article to share after you've been cooped up in your home for over a year. And oftentimes we find that the elderly do live on their own. They may have had a spouse who's passed away recently or previous to COVID, and most of that time they've been on their own. And so being inactive for over a year, it can take a toll on its body, and it's really important to visit and reconnect with your physician. And don't forget, ask for a referral for home health care. You need a skilled nursing evaluation. It's very important that you ask for that. And again, primary care physicians see many, many patients during the day. They want to assist you as best they can, but it might not be in the forefront of their head to think of a referral for you. So make sure when you speak with them to ask for that referral. And if you happen to forget as well, you can always call back the doctor's office, and what you'll notice is they have record of you that you're at a recent visit. They'll go over the notes and they'll see that physical therapy referral might be the right referral for you, even though they didn't do that quite at the time of your visit. If you have any questions, we'd like to see comments and always answer and start a dialogue for you. Please feel free to write comments to our direction. We'd be happy to get back to you. This is what we do. We see seniors. We've seen them in the past year, and we want to see them back active, getting some physical therapy at home, and of course, starting that daily routine pre-COVID. And so we're excited for many of our clients, many in our community. This is a wonderful time. We're on the tail end of it. We can feel it. Stay safe, stay well, and continue trekking on. We look forward to you in the next video.